So before we leave, I want to discuss the electronic health record just briefly. Do EHRs right now influence the continuity of care, positively or negatively? And are they a cost burden, or do they help things in the long run?
I think the way they're constructed and intended, they do help continuity of care, so long as that they are interchangeable. And what I mean by that is that there are so many different companies that are out there in the electronic medical record space, and some are compatible with one another, some are not. Some are easy to use, some are more difficult to use. So I think that the intent was, and I think it's still a work in progress.
But they're a cost burden. They cost
No
a lot of
question.
money. And in the early days of the EHR, what I used to hear is from small clinics in particular, we just spent X number of dollars, and usually it was a six-figure sum, to put this in, and 10 years, 5 years later, oops, the company's out of business. The software still works, but nobody integrates with it. We've got to buy a new system. We're out another 100 grand, 150 grand. Where does a small practice get this kind of capital? What do you do about that?
It's a major issue, obviously, and this is, at least in oncology, what we've seen is a lot of the smaller practices have migrated, for many reasons, this being one of them, to become part of a hospital-affiliated system.
So basically, you're telling me the EHR costs are driving small practices to merge with larger practices?
Well, not by themselves. It's just part of the whole laundry list of things that are forcing them to.
Is this a good thing? Anybody?
EHRs?
EHRs and other high capital expenses driving the small practices down so that they're all becoming part of larger conglomerates.
I don't think you can practice oncology today without an electronic health record. I don't think you can. And so it's just one of those costs of doing business.
But I think the point you were making, though, is that even if you could make one, you could have an electronic health record at hand in a community-based setting. Is the financial state where you're driving all those folks out of that arena?
Right.
Is that a good thing? And I think that comes with a whole set of trade-offs, in my view.
Boy, what we've discussed today is trade-offs.
Yes.
And the trade-off